Physiological changes that occurs during pregnancy. There will be changes in the uterus. Uterus increase in weight from 30 to 60 grams in nulliparous women to 800 to 1000 grams at full term, and this occurs due to the hypertrophy of pre-existing muscles mainly, which both occurs in width and length and by approximately 5 to 9 times. Also because of the increase in the amount of connective tissue and elastic tissue between the muscle fibers. All these effects are seen during first 2 to 3 months of pregnancy due to estrogen. Subsequent enlargement of uterus is due to the growing fetus and causes uterine wall to become thinner. Changes that occur in the body system and organs, like in the blood volume increases by 30%, that is 4 to 5.4 liters, and this occurs mainly due to the increase in the plasma volume. Therefore, RBC count, packed cell volume, HB concentration during uh, decreases, producing anemia, and it is called as physiological anemia of pregnancy. Its characteristic features are iron deficiency anemia, as iron demand increases during pregnancy. On plasma proteins, total plasma concentration decreases, serum fibrinogen increases, which increases the ESR, and serum albumin decreases, but the globulin concentration increases. Changes in the heart enlarges due to the pressure effect of enlarging uterus on the diaphragm. Cardiac output increases up to 5 to 6 liters due to increase in the stroke volume and the heart rate. Systemic blood pressure, both systolic and diastolic blood pressure decreases. The antecubital venous pressure is normal. Femoral venous pressure increase due to the pressure enlarged uterus on the pelvic veins. Blood flow through the hand and forearm increases. This increased flow helps in loss of excess heat produced by increased body metabolism. Effect on respiration, vital capacity. There is no change in the vital capacity uh, due to the upward displacement of the diaphragm gets compensated by increase in the width of the pleural cavity, whereas pulmonary ventilation increases due to the increase in the tidal volume and frequency of breathing. This may be due to increase in the progesterone level, which increase the sensitivity of respiratory center to carbon dioxide and cause fall in the arterial PCO2. The body oxygen consumption increases by 15%. Their action on GIT, that is, there is increased morning sickness, feeling of nausea and vomiting in early months of pregnancy. So there can be hypochlorhydria, there can be decrease in motility of the stomach and the colon because of the effect of progesterone. Effect on the urinary system, renal blood flow and glomerular filtration rate increases in parallel with increase in cardiac output. There will be increased GFR, which lowers the solutes presented for reabsorption, and this may account for the glycosuria of pregnancy. If you see the effect on endocrine glands, thyroid gland shows mild enlargement with hyperplasia and increased thyroxine output, but there are no signs of hyperthyroidism. Adrenal cortex shows enlargement of the zona fasciculata, a layer in particular, therefore cortisol secretion increases, but no signs of Cushing syndrome are seen. Placental hormones are secreted. The effect on the nervous system. Nervous system shows mild mental changes which vary from craving from unusual articles of diet to alteration in the mood and behavior. In some, a true psychosis may also develop. There can be changes in skin. Skin shows pigmentation of nipple, breast, areola, and linea alba. Brownish patches on the face and the neck also develop, and these changes are due to the oversecretion of ACTH and melatonin stimulating hormone. The metabolic changes that occurs during pregnancy. During pregnancy, there is a marked increase in the body weight on an average 12.5 kg. So there will be alteration in water metabolism. During early months of pregnancy, there is marked diuresis, sweating, and a weight loss of approximately 2.5 kg. During later months, that is around 5 to 6 months onwards of pregnancy, excess water is retained in the fetus, placenta, amniotic fluid, breast, uterus, and tissues. The retention of water is due to the fall in plasma protein concentration, especially albumin. Thus, the colloidal osmotic pressure decreases. Retention of sodium due to the steroidal sex hormone occurs. Protein metabolism. There is a positive nitrogen balance during pregnancy and during the lactation period. On carbohydrate metabolism, renal threshold of glucose decreases during pregnancy, producing glycosuria. On the fat metabolism, there occurs increase in blood concentration of cholesterol, phospholipids, and neutral fats. Adipose tissue fat increases to supply energy in the later stages of pregnancy and lactation. On the mineral metabolism during pregnancy, the mother stores approximately 50 grams of calcium and 35 to 40 grams of phosphorus. Only half the calcium goes to the fetus, especially during the last month, the rest being stored in the maternal tissues to be utilized during lactation. Effect on iron metabolism. The fetus contains 375 milligrams of iron, which accumulate at the rate of approximately 0.4 milligrams per day in the first 6 months of pregnancy and about 4 milligrams per day during last 3 months of pregnancy. A further 500 to 700 milligrams of iron is required by mother for increased hemoglobin synthesis and myoglobin formation in the growing fetus. The iron in the newborn child and iron removed in the blood lost during delivery amounts to 400 to 500 milligrams. This represents 1/8 to 1/10 of the total body iron and must be compensated by increased dietary intake of iron